The following portion of Daytime is sponsored on behalf of Florida Cancer Specialists and Research Institute by Chapel Roberts.
A cancer diagnosis is life-changing, and the Florida Cancer Specialists and Research Institute offers a range of therapies for treating patients with expert care. Here to discuss the ongoing advances in prostate cancer treatments is radiation oncologist Dr. Michael Scott. Dr. Scott, welcome. Thanks for being here.
Thank you.
How common is prostate cancer in this country, and who's most at risk?
So other than skin cancer, prostate cancer is the most common cancer affecting men in the United States. So approximately 1 in 8 men will experience this diagnosis in their lifetime. So many of us will have family members or ourselves will encounter this diagnosis in our lifetime, and thus it's very important to be educated on prostate cancer and how to reduce your risk and the best treatment options available when needed.
Also, we need to recognize the symptoms. So what are the warning signs, and what should men do if they have them?
That can be one of the challenges of prostate cancer. Unfortunately, many times prostate cancer can come without any symptoms at all. And this is one of the reasons that the American Cancer Society recommends screening for men. Generally around age 50, men are recommended to begin the screening process. And my colleagues at Florida Cancer Specialists and I, as well as a team involving urologists and primary care physicians, will be involved in this process for patients. Screening oftentimes involves a simple blood test called the PSA, and that's the prostate-specific antigen. And if this is elevated, that can lead to an MRI and eventually a biopsy to determine if cancer is present.
And what about treatment options? Are there many treatment options for prostate cancer?
So fortunately, the good thing is that there are an extraordinary number of treatment options for prostate cancer with very favorable outcomes. Those can include surgery, such as a radical prostatectomy to remove the entire prostate. Those can involve radiation therapy, which is what I practice in my clinic. And both of these treatments are the primary treatments for early stage prostate cancer. And the good news for men when they're affected with this early stage prostate cancer, the cure rate can be in the very high, up to 99% at 5-year survival rate. So men do extraordinarily well with these treatments.
So like every cancer, early detection really is the key. You have to stay on top of it. Are there advances in prostate cancer treatments? Have we come a long way?
So fortunately, with the technological advancements in radiation oncology, even as well as surgery, we are now able to offer much more patient-specific treatments. And so we have genomic testing based on the patient's own DNA of the tumor, and that can help guide whether patients can be cured with radiation therapy or with surgery alone. For some men who have more aggressive prostate cancer, they will receive treatments either by pill or injection that will help to reduce the level of testosterone in the body, and that helps to slow down the growth of the cancer cells. And so these treatments are very effective at trying to cure early stage prostate cancer. For those men who are unfortunately affected with more advanced prostate cancer, such as that spread to the bones, we now have a variety of treatment options that includes chemotherapy, that includes other pill medications that can target the prostate cancer cells, and even we have now radiopharmaceutical infusion therapy. These are therapies that can be simply received via intravenous, like receiving chemotherapy, but these are targeted just to the prostate cancer cells. And we offer these at Florida Cancer Specialists. They're a very convenient treatment option for our patients and have been shown to increase survival in men with these more advanced cancers.
Well, that's all very comforting. Doctor, thank you for being here and telling us about this.
Thank you so much.
You're welcome. And if you'd like more information, you can visit flcancer.com/prostate cancer. Daytime will be right back.
The preceding portion of Daytime was sponsored on behalf of Florida Cancer Specialists and Research Institute by Chapel Roberts.